Briefly, I will explain the biological and clinical background of why exfoliation is important in medical aesthetics. And next, I will briefly review how peeling agents have evolved from AHA to LHA. Then I will examine the clinical positioning of 쎄라필. Following that, I will present clinical cases to show what kind of result can be expected. And finally, I will discuss the synergistic effect when combined with the other therapies. The health of the skin surface begins with the delicate balance between keratinization and desquamation. Keratinocytes generated in the basal layer gradually move upward, accumulating keratin and eventually forming the stratum corneum. This stratum corneum serves as a protective barrier against external pathogens, physical stimuli, and transepidermal water loss. However, this barrier is not simply beneficial when it becomes too thicker. If aged cells are not shed at the appropriate time, the stratum corneum becomes unevenly thickened, leading to reduced light reflection, lost skin texture, and pore obstructions and microinflammation. Therefore, normal desquamation is not merely a shedding process, but a key physiological mechanism for maintaining epidermal homeostasis. In normal young adult skin, the turnover cycle from keratinocyte generation to desquamation takes nearly 28 days, 4 weeks. However, due to various internal and external factors such as aging, UV exposure, environmental pollution, hormonal change, and repeated procedures, this cycle becomes delayed. Clinically, when turnover is reduced, hyperkeratinization occurs, corneocytes accumulate, and barrier function becomes unstable. As a result, patients experience dullness, uneven texture, clogged pores, and decreased responsiveness to treatment. Therefore, controlled exfoliation should be understood not as a simple cosmetic approach, but as a fundamental strategy to normalize delayed turnover and restore epidermal function. The clinical benefits of controlled exfoliation are very clear. At first, it includes more organized keratinocyte differentiation and reduced abnormal keratin accumulation. And second, by precisely regulating corneocyte cohesion, it improves the structural quality of the stratum corneum and helps maintain a more stable skin barrier and moisture balance. And third, when epidermal renewal is promoted, remodeling signals are indirectly transmitted to the dermis, which can positively influence collagen synthesis and skin elasticity. And fourth, it lowers surface resistance, thereby improving the penetration of active ingredients and the delivery efficiency of energy-based device. In other words, appropriate peeling has significance beyond the standalone procedure and function as a platform that influences the outcomes of subsequent treatment. In medical aesthetics, exfoliation can be broadly classified into four methods. First, there are mechanical approaches such as crystal peeling or diamond peeling, which utilize physical friction. Second, there are methods that use light-based energy such as CO2 laser, fractional laser. which act on the skin surface or dermis. And third, there are approaches that deliver thermal energy through radio frequency or needle-based device to induce regeneration. And fourth, there are chemical peels using acid-based agents such as AHA, BHA, PHA, and LHA. Among these, chemical peeling remains the most widely used method due to its ability to control depth, relatively high reproducibility, and ease of repeated application. The concept of peeling in the past was dominated by the belief that stronger intensity equaled better efficacy. Procedures such as panel peeling or TCA peeling, which induce visible peeling, were performed and downtime, erythema, and irritation were generally accepted. However, the current direction has completely changed. Particularly in Asian populations, the risk of PIH is relatively higher, and within the increase in sensitive skin and barrier compromised patients, the limitation of aggressive peeling have become evident. And now, what is important in clinical practice is not strong exfoliation, but rather peeling that is low irritation, repeatable, barrier preserving, and capable of stabilizing the outcomes of subsequent treatment. And then let's compare of the AHA to LHA. The evolution of peeling agents represent not simply generation change, but a process of finding a balance between efficacy and irritation. AHA, which means alpha hydroxy, is water soluble and acts rapidly on the skin surface, but is associated with irritation and photosensitivity. And BHA, beta hydroxy, is lipophilic and has affinity for sebum and pores, but may still cause irritation and dryness. PHA has a larger molecule size and is relatively gentle, but has a slower onset of action. And LHA, lipohydroxy, is lipophilic with slow penetration and function at pH close to physiological levels, making it a more refined approach that can be applied even to sensitive skin. Therefore, LHA is not simply a new exit, but a result of an evolved peeling paradigm, aiming for low irritation and precise action. So we call LHA as a fourth generation peeling. The most important characteristic of LHA are its high lipophilicity and slow penetration. While conventional exit tends to rapidly disrupt corneal site cohesion, LHA acts more gradually, including more uniform desquamation. In other words, rather than quickly dissolving the surface, it modulates intracellular bonding in a controlled manner, which is the main mechanism. This results in smoother skin texture while minimizing excessive irritation and demonstrates strong affinity in sebum-rich areas and comedone-prone environments, making it clinically valuable. Clinically, LHA can be interpreted not merely as a peeling agent, but as a regulator of epidermal renewal. It promotes corneal site shedding through desmosome disruption while also contributing to the reduction of melanin accumulation, increased basal epidermal thickness, and stimulation of extracellular matrix regeneration signals. Additionally, its comedolatic effect makes it particularly beneficial in acne-prone skin where sebum and keratin accumulation coexist. 쎄라 is a solution based on the advantages of LHA, aiming not only for exfoliation but also for normalization of the epidermis and optimization of the skin environment. The key point is not to induce aggressive peeling, but to prepare the skin for subsequent treatments. Therefore, while 쎄라 can be meaningful as a standalone peeling treatment, in actual clinical practice, it is more frequently utilized as a preparatory platform that enhances the quality of combination therapies. The core concept of therapy is peel and fill. Conventional peeling has primarily focused on removing the stratum corneum, which can be described as a remover-centered approach. In contrast, the peel and fill concept represents an expanded approach beyond simple removal. The peel phase organizes accumulated hyperkeratonic layers in a more uniform manner, restoring epidermal turnover to a physiological level. At the same time, the fill phase stabilizes the microbiome and skin microenvironment, promoting a healthier barrier function and skin reactivity. Thus, rather than remaining at the level of exfoliation, 쎄라 simultaneously organizes the surface and restores the skin environment, resulting in a more stable and predictable skin condition. The peel and fill concept is realized through the patented technology of 쎄라. Exfoliation in 쎄라 does not rely solely on LHA as a single component, but rather utilize both LHA and the patent technology USP solution to induce a more refined and advanced exfoliation process. USP solution acts by modifying the lipid environment within the stratum corneum using lipid-based structures. Specifically, it is based on oleic acid and lauric acid derived from olive oil and coconut oil, and through a process that converts these into more hydrophilic forms, it gradually loosening intracellular cohesion. This mechanism allows for more uniform exfoliation without abrupt barrier disruption, while simultaneously improving the skin's moisture binding environment. As a result, USP solution can be understood not merely as an exfoliating agent, but as a biochemical modulation-based mechanism that regulates epidermal turnover under low irritation conditions. As you can see, USP solution demonstrates a tendency to act more effectively on protein structures. Through comparative testing with the other LHA-based peeling agent, we are able to confirm that 쎄라 exhibits a more effective action on keratin protein surface. Next, Vector Technique KIS represents a microbiome-based approach. In recent dermatologic research, it has been emphasized that skin barrier function and inflammatory responses are closely associated with the skin microbiome. In particular, these biases in which bacterial balance is disrupted can lead to increased inflammatory responses, decreased barrier function, and worsening of acne and sensitive skin condition. Dental technique KIS utilize lactobacillus-based technology to promote a more stable microbiome balance and modulate the skin's immune environment. This approach can help reduce post-procedural inflammation, promote barrier recovery, and maintain skin stability during repeated treatment. And many of you may be interested in the actual treatment protocol, so here are some videos for reference. As you can see, it is a relatively simple protocol in which the skin surface is first prepared using a dedicated cleanser followed by the peeling step. And now let us review the clinical outcomes through actual cases. This is a case with combined concerns of pigmentation, sebum, and enlarged pores. The patient underwent a total 3 sessions at 1 week intervals. As shown, after treatment, the pores around the nose appear more refined, and the overall skin tone and texture have improved. What is notable in this case is that this is not merely a result of exfoliation. Sebum regulation was also achieved, leading to a reduction in whitehead and blackhead, and the skin surface become more uniform and smoother. Additionally, despite being applied to sensitive skin, the treatment shows stable result without significant erythema or irritation. And case 2. This is a case primarily involving pigmentation. The patient underwent 5 sessions at 1 week intervals. As you can see, overall pigmentation was reduced and skin tone became more even. Localized spots and micropigmentation gradually decreased, and the skin appeared clear and brighter overall. These changes can be interpreted not simply as exfoliation, but as a result of normalized epidermal turnover, leading to the uniform removal of melanin-containing corneocytes. And here's an acne case. This is a case of acne-prone skin. In such cases, follicular hyperkeratinization, sebum retention, and inflammation coexist. Therefore, simple anti-inflammatory treatment is insufficient, and normalization of follicular keratinization and sebum control must be addressed together. Due to this, its lipophilic nature, LHA is effective in sebum-rich environment and helps reduce pore blockage due its comedolytic effect. After 3 sessions at 1 week interval, inflammatory lesions are reduced and overall skin tone becomes more stable. And same patient. Post-acne erythema was also improved, and the skin surface become more uniform and smoother. This result can be interpreted as stabilization of the follicular environment and reduction of microbiome formation. Based on this clinical background, we will now examine how 쎄라 can be utilized in real clinical practice and what type of synergetic mechanism can be observed when it is combined with other procedures. The current trend in medical aesthetics have moved beyond single treatment and combination therapy, integrating various energy-based device and injectable treatment has become the standard approach. What is important here is not simply combining multiple procedures, but rather designing how each step can enhance the effectiveness of the others through their biological and procedural interconnection. In particular, 쎄라 plays a role in the pre-treatment stage by organizing the uneven stratum corneum and stabilizing the skin microenvironment, functioning as what we refer to as a skin conditioning step. This process provides a foundation that allows more uniform energy delivery and such as consistent biological response in subsequent RF or HIFU and skin booster treatments. We will look at the synergy between 쎄라 Peel and radiofrequency lifting device, which is one of the most commonly used combination in clinical practice. RF device deliver electrical current into the skin, generating thermal energy that acts on the dermis. One of the key factors in this process is the impedance of the skin surface. When the stratum corneum is thick, uneven, or dehydrated, electrical resistance increases, leading to uneven energy distribution, where energy may concentrate in specific areas or fail to be delivered sufficiently in others. As shown in the upper left figure, areas with thick keratin or low hydration exhibit high electrical resistance. Electrical current tends to follow through the areas of lower resistance. And in such case, localized energy concentration can lead to arcing phenomena or hotspot formation, increasing the risk of burns. In contrast, the LHA component of 쎄라 gently loosens intracellular cohesion between corneocytes and enhances moisture binding capacity. As illustrated in the upper right figure, when surface resistance is uniformly reduced, RF energy can penetrate more evenly into the dermal layer without resistance. Another important factor is the hydration state or conduction medium. RF energy generates heat through oscillation of water molecules and ions, so higher skin hydration improves energy delivery efficiency. As shown in the lower figure, dehydrated skin presents a suboptimal conduction environment. However, 쎄라 Peel activates NMF, the natural moisturizing factors, creating an immediate hydrate state at the epidermal level. As a result, even with the same number of shots, more uniform and efficient thermal delivery can be achieved, leading to more stable and predictable lifting outcomes in clinical practice. And secondly, we will discuss the synergy between 쎄라 Peel and HIFU device, one of the primary modulates for lifting procedures. Ultrasound energy cannot propagate through air, which makes proper coupling critically important during treatment. This is why coupling gel is routinely used. However, in actual clinical settings, when the skin surface is rough or corneocytes are loosely attached, micro air gaps can form between the device tip and the skin, resulting in energy scattering or reflection. This can lead to inaccurate delivery of energy to the target depths. When 쎄라 is applied beforehand, the stratum corneum becomes more uniform and a full contact condition between the ultrasound transducer and the skin can be achieved. This allows energy to be delivered more precisely to target layers such as smooth layer. Another important factor is the hydration-dependent transmission efficiency. Ultrasound propagation is influenced by the hydration state of the tissue. 쎄라's propurity technology improves the skin's moisture binding capacity, thereby enhancing the transmission environment. A well-hydrated epidermis acts as a guide that minimizes surface refraction and allows ultrasound waves to be more efficiently absorbed. As a result, ultrasound energy can be delivered more deeply and uniformly, leading to more accurate and consistent lifting outcomes in clinical practice. And next is combined with skin boosters. The synergy between 쎄라 and skin boosters, including MTS, which are currently among the most widely utilized treatments in clinical practice. The key objective of skin booster is how efficiently active ingredients can be delivered deeply and uniformly into the dermal layer. Although these treatments are designed to deliver active substance into the dermis, their effectiveness can be significantly influenced by the condition of the stratum corneum. When the stratum corneum is thick and uneven, needle resistance increases during the injection, and in topical applications, penetration of active ingredients becomes limited. By preconditioning the skin with 쎄라, the surface structure becomes more uniform and the lipid environment becomes more flexible, optimizing the pathway through which active ingredients can penetrate. And next, final synergy case involves the combination of 쎄라 peel with laser treatment or pore scars. Procedures such as potenza or picosecond fractional lasers include controlled micro-injury to stimulate regeneration, and 쎄라 peel helps effectively manage the associated discomfort during the recovery process. As we have seen through this combination with RF high-flow skin boosters and laser treatment, a common observation is that treatment outcomes are significantly influenced not only by the type of procedure, but also the condition of the skin at the time of treatment. Therefore, to achieve consistent and reproducible synergy, it is important to structure these procedures into a unified protocol rather than approaching them individually. Based on this concept, the integrated treatment protocol with 쎄라 can be organized in 3 stages. The first stage is pre-treatment or skin priming, where 쎄라 is used to remove debris and excess keratin, creating a more uniform stratum corneum and reducing surface impedance. The second stage is the main procedure, where treatments such as RF high-flow laser or skin boosters are performed. Because the skin has been preconditioned, energy delivery becomes more uniform and deeper, and thermal distribution is more stable. The final stage is post-treatment, where the skin is soothed and barrier recovery is promoted through regenerative care, enhancing the overall outcome. And this concept can be structured into 3 clinical periods. And in Korea trend, this concept is already being widely applied in clinical practice in Korea. 쎄라 is rarely used as a standalone treatment, but is instead incorporated into combination programs with devices such as LDM, laser, or HIFU. These programs are not simply a combination of procedures, but structured protocols that begin with skin conditioning, followed by energy-based treatment, and conclude with recovery phases. This trend is expected to become increasingly important not only in Korea but also in the global medical aesthetic market. In conclusion, peeling should no longer be regarded as a simple exfoliation procedure, but rather as a skin conditioning step that regulates the skin environment and enhances the efficacy of subsequent treatments. 쎄라필, through its peel and fill concept, provides an approach that simultaneously refines the surface, structure, and stabilizes the skin microenvironment. Moving forward, the key is not only which treatment is performed, but in what condition the skin is treated. And thank you for your attention.